Should I feel guilty about sickle cell carrier status? Feeling guilty about being a carrier of sickle cell trait is a common emotional response, but it is important to understand that carrier status itself is not something to feel guilty about. Being a carrier means you have inherited one copy of the sickle cell gene but do not have sickle cell disease. Carriers usually do not experience symptoms of the disease but can pass the gene to their children. From a medical and genetic perspective, carrier status is simply a part of inherited genetics and is not a personal fault or moral failing. It occurs naturally and is not caused by anything you did or did not do. Feeling guilt related to carrier status often arises from concerns about the risk of having a child with sickle cell disease, which happens if both parents pass the sickle cell gene to their child. It is important to focus on understanding your genetic status and communicating openly with healthcare providers and family members. Genetic counseling can help carriers understand reproductive risks and options to reduce the chance of having a child with sickle cell disease. This proactive approach empowers individuals rather than leaving them with guilt. In the context of sickle cell disease, guilt is more commonly reported among patients living with the disease or parents of affected children due to the challenges and suffering involved. However, guilt is recognized as an unproductive emotion that does not help improve outcomes. Instead, shifting toward empowerment, education, and support is recommended. Practical steps to manage feelings of guilt about carrier status include learning about sickle cell trait and disease to understand what carrier status means and does not mean. Seeking genetic counseling can clarify reproductive risks and family planning options. Recognizing that being a carrier is a natural genetic occurrence, not a personal failure. Connecting with support groups or counseling services can help process emotions and gain perspective. Focusing on health and well-being rather than blame. In summary, while feelings of guilt about sickle cell carrier status are understandable, they are not medically justified. Carrier status is a genetic trait, not a cause for guilt. Emphasizing education, support, and proactive health decisions is the best way forward. Remember, knowing your status allows you to make informed choices and seek guidance from healthcare professionals. It's important to approach this with understanding and compassion for yourself, recognizing that genetics are a natural part of human diversity. Always consult with healthcare providers for personalized advice and support tailored to your situation.